Did you know that when an elderly patient suffers a hip fracture, they might lose a significant amount of blood without anyone even realizing it? This is called hidden blood loss, and it's a serious challenge for anesthesiologists. But what causes it, and how can we manage it effectively? Let's break it down in this episode of Optimal Anesthesia, simply and clearly. Why does it happen? There are a few key reasons why hidden blood loss is so common in elderly hip fractures. 1. The trauma itself. When the hip breaks, blood leaks into surrounding tissues, like the thigh and retroperitoneal space. This can amount to as much as 2 units of blood. 2. The type of fracture. Certain fractures, like intertrochanteric ones, bleed more because they're closer to rich blood vessels. 3. Medications. Many elderly patients are on blood thinners, which make it harder for their body to stop the bleeding. 4. Age-related changes. With age, our bones become brittle and our blood vessels more fragile. This combination worsens the situation. This silent issue can have serious consequences if not addressed, and we're here to tell you why. An undetected drop in hemoglobin can cause anemia. And anemia leads to slower recovery, more hospital days, and delays in rehabilitation. This is especially critical in elderly patients who need to regain mobility quickly to avoid complications like bed sores or infections. Anemia doesn't just slow recovery, it can push the heart and lungs to work overtime. For patients with existing heart or lung conditions, this added stress can lead to serious complications. It's like asking a car with a worn-out engine to climb a steep hill. Here's the tricky part: hidden blood loss often goes unnoticed because traditional methods, like monitoring drains or visual inspection, don't pick it up. That's why we need advanced tools, like imaging and frequent hemoglobin tests, to keep a closer watch. So, how can we stay ahead of this silent thief? 1. Monitor hemoglobin levels closely. A drop after surgery might not just be due to dilution, it could indicate hidden blood loss. 2. Optimize patients before surgery. Boosting hemoglobin levels with iron or erythropoietin can help reduce the impact. 3. Minimize surgical trauma. Less invasive procedures can lower the risk of hidden blood loss. 4. Balance blood thinners. Adjusting anticoagulants carefully reduces bleeding risks without compromising clot prevention. Think of it like an iceberg. The part you see is only a fraction of the problem. But with vigilance, tailored strategies, and continued learning, we can ensure better outcomes for our elderly patients. Thanks for watching. Together, let's uncover solutions for better care. Visit optimalanesthesia.com for more insights.